Depression can often accompany chronic illnesses, adding an extra layer of challenge to an already existing difficult situation. Let's explore in this video how depression can impact those living with chronic illnesses and some strategies for managing it. Hey there, thanks for stopping by and welcome back to my channel. If you're here for the first time, I'm Ms. Devi Sundar, founder and director of Teletherapies and Breathe Thrive. By professional trade, I'm a respiratory physiotherapist and a psychotherapist for over 2 decades. Before I could go any further into this video, if you have already not done, please do hit that subscribe button and the notification bell so you get notified on my weekly video. So first thing first, let's define what is chronic illness and explore some examples so you understand what we are really talking about. Chronic illnesses or the long-term health condition that typically last for a year or more and require ongoing management. These conditions often have no cure, but can be managed with treatment and lifestyle changes. Chronic illnesses encompass a wide range of conditions affecting different body systems, including diabetes, a chronic condition characterized by the elevated blood sugar levels, either due to the body's inability to produce insulin, that's type 1 diabetes, or ineffective use of insulin by the body, this type 2 diabetes. The second one is the heart disease, conditions such as coronary artery disease, heart failure, and arrhythmias that affects the heart function and increase the risk of heart attack and strokes. The third leading chronic illnesses is chronic respiratory disease, conditions such as asthma, COPD, pulmonary fibrosis, cystic fibrosis. These are the examples. There are many chronic respiratory disease existing, and that affects the lung and the ability of the lung function, leading to breathing difficulties and reduced lung function and capacity. The fourth one is the arthritis, group of condition characterized by inflammation and stiffness of the joints. Examples are osteoarthritis, rheumatoid arthritis, or gout. The fifth one I would like to shed light on is the chronic pain conditions. Conditions such as fibromyalgia, chronic migraine, and neuropathy that cause persistent pain and discomfort often impact the daily functioning and quality of life. The sixth one is the autoimmune diseases, conditions in which the immune system mistakenly attacks the healthy cells and tissues of their own body, such as rheumatoid arthritis again, lupus, and multiple sclerosis. The seventh one is mental health disorder. Conditions such as depression, bipolar disorder, anxiety disorder, schizophrenia that affects the mood, behavior, and the cognition often require a long-term management. These are just few examples of chronic illnesses that I've thrown out here, but there are many other chronic illnesses, each with its unique challenges and having unique management strategies to follow. Living with a chronic illnesses can be very difficult, but with a proper support and management, individuals can lead a fulfilling life. Now, in this video, I'm going to focus on depression in chronic illnesses. Coping with chronic illnesses can be very overwhelming, and it's not uncommon for individuals to experience feelings of sadness, grief, or hopelessness as they navigate the challenges of their condition. Chronic illness can also affect the brain chemistry and neurotransmitter levels, increasing the risk of developing depression. Common symptoms of depression in the context of chronic illnesses is not much different from the depression diagnosis by the DSM-5. So prominently, you might find people with persistent sadness, loss of interest in activities, changes in the appetite or the weight, fatigue, difficulty in concentrating, and thoughts of death or suicide. Symptoms of depression can overlap with the symptoms of the chronic illnesses itself, making it more challenging for individuals with chronic illnesses to handle this, both the physical and mental health. And you might remember my previous video, decoding depression diagnosis, where I explained the criteria by the DSM-5 for diagnosis of depression. So it is not different from the diagnosis criteria, but with chronic illnesses, it's so challenging to identify or differentiate between where the cause of depression is originating from. Whatever the reason might be, managing depression in chronic illnesses is very, very important for improved quality of life and also for the survival of the individual. So I'm going to give you some strategies to manage depression in chronic illnesses. Number one is building a supportive network. Find a supportive group friends and family and healthcare professional who can understand your symptoms and provide encouragement and assistance in the treatment management. Two is seeking professional help. What this means is seeking out for a mental health professional while having a chronic illness is very, very key, as it is important to manage your mental health disorder with the right mental health professional. Therapy can be particularly beneficial in helping people to cope their symptoms while managing their chronic illnesses. Number three is practice self-care. Take time to engage in activities that bring you more relaxation and joy, whether it's spending outdoor or practicing mindfulness or pursuing your hobbies or interests. Number four is stay connected. Stay connected with others having similar chronic illnesses through online communities, or this would provide you a validation and emotional support, which will help you to manage your mental health and your chronic illnesses in a better way. Remember, living with chronic illnesses can be challenging, but connecting with the right people and the right support will help you to be validated emotionally and also manage effectively your condition. And there you have it all, folks. Depression in chronic illnesses and some strategies to manage it effectively. Remember, your mental and physical health is very important for a good quality of life. So let's take action to live with a better health. Breathe better, think better, and live better. If you like this video and found this informative, please do hit that like button and subscribe and share with your friends and family. As usual, stay curious, stay healthy. Signing off, Devi Sundar.